say a big thank you for having me and coming to deliver your little first aid session today. It's a pleasure to be here and deliver this Beulah Health Week. And so I was just listening to Samantha's presentation, and I have to say, I'm the sort of same background as Samantha. I'm a paediatric nurse. I go back slightly longer. I qualified back in 1994, so I've done about 25 years in the NHS. I worked in various different departments all around London. You'll know the hospitals, predominantly in Great Ormond Street Hospital and the Royal London Hospital. I've worked with tiny little babies, neonates who were prem-born at 24 weeks early, and some survived them, which is amazing, and right through to kind of your big beefy adolescents. A part of my career was also spent at the Royal London in the trauma unit. I left the NHS about 2 years ago now, and I decided to venture on another pathway. I absolutely love my teaching, and in the back of my mind, teaching was probably a pathway that I wanted to go into nursing. And the last sort of 8 years in my career as a nurse, I was what was called the paediatric development nurse, and that kind of steered me to where I am now. And I'm now one of the lecturers at City University of London, and I teach in the School of Health Sciences, but predominantly in child health. So I look after all those students that Samantha will see on the wall. I do all their training as a student nurse. Tots2Teens First Aid is my own company, and I've had this up and running about 8 or 9 years now. And predominantly I go into houses, into parents who have newborn babies with their grandparents and maybe their family friends, and I deliver them essential training skills and first aid skills in order for them to be able to save their baby's life. So we look at emergency first aid skills. Now the reason Tots2Teens sort of came around was about 8 years ago. I was with a friend of mine, and she had a baby who was probably about 9 months old at the time. We were in a coffee shop, baby sat there, she'd been weaning, absolutely fine, no problems. And when we was in the coffee shop, baby started choking on a biscuit, and my friend just, as you can imagine, just flipped. She had no first aid knowledge, didn't know what to do, how to manage the situation. And I managed to help the baby, and quite easily the object came out of the throat. But what kind of dawned on us afterwards is that there was a real need to get the skills out to the community. So that's kind of where Tots2Teens started off 8 years ago. Okay, so what we're going to look at, guys, is we're just going to look at some basic first aid skills, really, so you can manage some things at home. Subjects that we're going to be looking at this evening is, first of all, we're going to have a look at bleeding. And I'm going to do some demonstrations. I've got my little baby Annie that comes with me when I go out teaching. So I'm going to do some demonstrations on baby Annie so you can see how we're going to manage it. Then we're going to have a look at burns, how to treat a burn. We'll also cover bites and stings, and then we'll talk about the contents of your first aid box. After that, I've just got a few little questions for you to answer. We can run through them, test your knowledge, and then we'll have time for some questions after that. Okay, so the first subject, guys, I just want to talk to you about is bleeding. Now, bleeding is usually minor, but it can be serious, and it can be a threat if there's a large vein or an artery is injured. Now, the way you'll know whether it's a large artery or if a large artery is injured is because arteries run under high amounts of pressure to get all that oxygenated blood pumped around our body. If we were to sever an artery, that bleeding just wouldn't trickle out like you do when you cut yourself. It would be coming out at very, very high pressure. Okay, so that's the main difference between an artery bleed. However, we're going to talk about just your everyday cuts and grazes. We'll start with that. So let's put it into a little scenario. You fall over, you've got a bit of grazes on your hands and knees and all the places that you're going to get them. And the way you're going to manage that is just under cold running water. I just want you to just let the cold water fall on it in order to get any bits of gravel or debris out. And if it's not, just give it a little helping hand out and try and clear that area. And then if it's a small bleed, just pop a little plaster on it and that'd be absolutely okay. If it's a larger wound, what we're going to do is that we're going to manage it, and I want you to try and remember the word seat in order to manage the larger wound. Now, the way we're going to manage that is preferably sit that person down, because if they have lost quite a bit of blood, there is a chance that they could go into shock and they might faint. So always good just sit them down and give them lots and lots of reassurance. I want you then just to examine the wound, have a look inside it. and just check that there's nothing embedded inside that wound. Now, if there was an object embedded in that wound, I don't want you to be taking it out, because the problem is it might be quite deep. And if it's deep, that could be stopping an arterial bleed. All right, that alone would stem that bleeding. So if there's anything in there, let's say, for instance, I'm trying to think of some of the things that I've come see with children, sticks in their body where they've fallen over and maybe a little stick has gone through the hand. I've seen a screwdriver in part of a body as well. So anything like that, we're not going to remove that object. We'll leave that for professionals to do. Now, the way we're going to manage that wound is when it's bleeding, I want you to go to your first aid box and get out a pair of sterile gloves. Really important that any blood, any other people's blood that we're dealing with, that we're going to protect ourselves and wear some gloves. So we're going to pop the gloves on. And then what I want you to get is some material. It's called non-woven gauze, and it's not like cotton wool. This is really, really important. Cotton wool has got fibres on it, and those fibres would stick in that person's wound, which could then later on lead to an infection. So this non-fibrous wound gauze is what we're going to use in order to stem the bleeding. And the idea is we want to stop the bleeding as quickly as possible. So with gloves on, some sterile pads preferably, we're going to just apply direct pressure over that casualty's bleed. Now what we're going to do is we need to be applying pressure for at least 10 minutes. Now the other thing that we're also going to do is I want you just to elevate that wound above that person's heart. And that's really important, because what that will do is that will prevent the blood from coming out of that wound, and actually, in fact, it will slow the blood down, because this blood is it's harder for it to go up a gradient. So that's really going to help you to stem the bleeding. After approximately 10 minutes, I want you to just take the pressure off and just check to see whether or not the bleeding has stopped. If the bleeding hasn't stopped, go back to applying pressure, elevate that wound for another 10 minutes, recheck that wound. If it's bleeding after 30 minutes, if you're unable to stem the bleeding, it's really important at this point that you call 999 or take that person to hospital and get some medical help. All right. Now, I just mentioned about looking on that pad after 10 minutes to see if the wound has stopped bleeding. If you notice that the wound hadn't stopped bleeding, but the blood seeped through, please don't go pulling that bottom layer of dressing off of that wound, because what's going on that wound is the platelets would have rushed to that area, and those platelets are going to help the blood clot. Now, if I go pulling that bottom layer off, all I'm doing is interfering with that platelet production, and all that's going to happen is I pull that off, the platelets are going to disappear, and the child's going to, or the person's going to continue to carry on bleeding. So if there is more blood's come through, rather than take it off, get some more gauze, take it out the pack, and just plant it on top of each other and elevate it. Okay, so that's a little bit about bleeding, and they're just probably your everyday to-day wounds, your cuts from a knife cut in the kitchen, falling over and cutting yourself. Now, one really important thing, guys, as well, if bleeding is severe, please, please, please don't waste time going to look for a suitable dressing. It might be, and be prepared, I've had to do it once or twice, where I've either had to use my hand to push that wound together to try and stem that bleeding because I haven't got a suitable dressing, or if not, you could get that patient, the casualty, to do it themselves. All right, and all you want them to do is just hold that wound together, and what that would do is encourage that clotting process. Okay, so moving on, we're going to talk about nosebleeds. So there's always a lot of, well, people are never really sure with nosebleeds of how to treat them. So a lot of people think head forward, some think head back, some people think pinch soft bit of the nose, some people think hard bit. So we're just going to talk about how we're going to treat your nosebleeds. Now, just nosebleeds are really common, and they're really, really common in children, particularly because they like to put their fingers up their nose. But other reasons that nosebleeds can also happen is they fall on it and we can bang our nose, football object can go onto it, cause bleeding. And we've got the capillaries in our nose that causes the bleeding. They're really, really fine and delicate. which is why it's sometimes so easy for some people's nose to bleed. Now, if we have a nosebleed, lots of people don't like it. It's not very nice because all you can taste is blood trickling down the back of your throat, and that might make people quite anxious. So give them lots and lots of reassurance. Now, the way we're going to manage that nosebleed is again, get that casualty to sit down and just have a little look to see if there's anything embedded up the nose. Again, if there's anything up there, don't go trying to pull it out. We're going to seek medical help and we're going to get them to remove the object instead. Now, what we're going to do with our nosebleeds, pretty similar to any bleed, is I want you to tip the head forward. And that's really, really important because tipping the head back, all that's going to do is cause blood to go down the back of that person's throat and potentially can cause a bit of choking. So we're going to tip the head forward to keep that airway open and clear. And then what we're going to do is we're going to pinch pressure on the soft part of the nose. So if you were to feel, if you come up to where your eyes are and start feeling the bridge of your nose, and you come down and just to where it starts to sort of flare out, it's nice and soft there. And we're going to pinch that part of the nose and put that person's head downwards. Now, the other thing that you really need to encourage them to do when you are pinching their nose to stem that bleeding is to encourage them to breathe out their mouth, especially children, because it can make them quite anxious as well. Okay, so just a quick reminder, pinch the soft bit of the nose and pop that head forwards. Okay. Okay, so I'm going to show you this next slide and I'm just going to warn you it's an embedded object. Okay, so embedded object, guys, again, they are quite common because I see quite a lot of children come in with various bits inside their arms, legs and parts of their bodies. Now, like I said earlier, really, really important that we don't remove that object. We're always going to seek medical help with an embedded object. Now, the way we're going to manage that is, as you can see in the picture, I still want you to provide direct pressure to that wound, but we're going to apply it around that object. And again, you can just see in that picture how they use padding. And what they've done is they've just padded up the side of that screwdriver to prevent it from moving. And that's really, really important because when the ambulance crew arrive and the person's transferred to hospital, we don't really want this embedded object to be moving around freely, because all that's going to do is interfere with that bleeding process and it's going to continue to make the area bleed. Okay, so that's embedded object. Oh, amputation. I bet lots of people, you know, someone who's chopped a little bit of their finger off. I don't know if you can see mine. I've done mine, chopped it off. But again, amputations are very common, particularly amongst children, where they get their fingers shut inside doors. So please, when your grandchildren and young children are around, guys, be really, really careful. And it's not the door side, it's generally where the hinges are on that part. So please be really careful with them. Now, amputated bits, it's probably going to churn your tummy a little bit when you see a little part of a finger sitting on the side after that child's had that person's had their accident. So just take a deep couple of breaths. Now, I want you, the bit that's bleeding, i.e. the non-severed part, I want you to treat that like a wound. So we're going to apply that pressure and elevate it above the heart to slow the bleeding down. And then what I want you to do with that severed part is be really, really careful with it. I want you to pick it up and I want you to just go and place it inside a plastic bag. Just a freezer bag is absolutely fine. They're nice and clean inside. Once it's in that plastic bag, you can put some cotton wool around it or a cloth if you've got one, or again, some of these gauzy bits if you've got them, just to protect it. Then I want you to place that whole protected piece of, bag with the finger inside it, inside some ice. Because what the ice does is it keeps the temperature cool, which will keep those blood pumping. All right, and there's a really good chance that when you take that part to the hospital, they can sew it back on with really, really good effects. All right, now again, really important, just note the time of the accident. So then when we get to hospital, we can let the surgeons know and then they can sort of determine how long they've got and how quickly that they need to get that person to the hospital. And don't forget to take that severed part with you, really important. Okay, all right, burns and schools. I'm just going to clarify burns a little bit, just to go through, because there's lots of different classifications of burns, and generally we are going to treat them all the same. Now, some burns, guys, can be life-threatening, and some do require emergency treatment, and we'll talk about what you need to be looking for and when you need to be going to the hospital with a burn. Now, like I said, burns are classified into lots of different areas. We've got dry burns. Dry burns can be caused from flames or maybe hot objects. We've also got wet burns, which are generally called from liquid and steam. So they're the burns that are generally going to happen in your kitchen. You've got your hand over the pot that's bubbling away, and before you know it, you've burnt yourself. Radiation, and that's generally sunburn. We've got cold burns, such as frostbite, that can be caused from extreme cold weather. And then there's chemical burns from liquids and also electrical burns. Now, the way we're going to deal with burns doesn't matter on their classification, except for electrical burns, which are going to be treated slightly different, because the first thing we need to do is make that person safe. Now, with all your burns, the way we're going to treat it is, if you can remember that 3-letter algorithm, call, cover, you've nailed it. Now, the first thing we need to do is, if that burnt area, it's going to be really painful, it's stinging, it's burning, we need to cool it down. And it's really important that we cool that area down for at least 20 minutes. All right, how many of you burnt your hand in the oven? You've thought, oh, must just cool it down because it's burning. You leave it running under for 2, 3, 4 minutes because we're lazy, and it feels better. And then the minute you take it out of that water, that burning pain sensation just comes back. That's because we haven't cooled it down for long enough. Really cool that burn down, because that will massively reduce the pain from that burn. And not only that, it will help with the outcome, with the healing of that burn as well. Now, if it's a large area burn, or the burn has gone through the clothing, what's really important is that you don't go moving that clothing off. Because all you're going to do, if I've burnt my arm where clothing is stuck, and somebody tries to pull that clothing off, burns are sticky, there's a lot of sticky fluid in them, and all that's going to do is just going to pull more and more layers of the skin away. Therefore, the person's injury could be worse, they could be at risk of shock because they're also losing a lot more fluid, and also their risks of infection is a lot higher as well. All right, so leave the clothes on. If it's a large burn area as well, you might need to think about how you're going to cool that area down. So think about, put them in the shower, cool water, not freezing cold, just cool water to cool that burn down for 20 minutes. Now, once you've cooled the burn down, you need to decide whether you call the hospital or you go to the GP for advice. Now, I would always recommend that you do go to hospital if the burn is bigger than that casualty's hand. So it's a really, really good indication of whether you need that person to go to hospital, use their hand. So if my burn was bigger than my hand, I need to go to hospital. Okay. The other times that I would also encourage you guys to go to hospital if the burn is on your genital areas, really important. Other times as well is if the burn, after cooling it down for 20 minutes, it's black or it blisters, that tells us that it's a deep burn, and it's a really good idea that you go to hospital in order for us to get a second opinion on it from the surgical burns team. Okay, now one other thing before you leave the house, if you are going to the hospital or you're going to the GP, if we've got a burn, we've gone through all our layers of protection because our skin's there to protect us, which means we are at a higher risk of infection. Okay, and actually, guys, this could be one reason for developing sepsis, possibly after a burn as well. I do not want you going out with that exposed burn. Please just get a piece of cling film, cut enough cling film to cover the burn area. You don't need to wrap it round, just cover that burn area. That will protect that area from becoming infected. And then we can get to the hospital or go and get that advice that you need. All right. So quick summary, burns, cool it down 20 minutes. Don't remove any clothes. Call the hospital, get advice if the burn is bigger than that casualty's hand or it blisters straight away or goes black. And then you're going to cover it with some clean film if you're exposing the burn to the outside. Okay, a couple of nevers. As tempting as it is, and I know we all love to burst blisters, please don't do that, because by bursting blisters, all we're doing is increasing the risk of infection. All right, so no matter what the temptation is, please don't burn that blisters. Don't touch that burn either with your hands, because like we just said, burns are really susceptible to infection, and we've got lots and lots of microorganisms on our hand that could potentially infect that person. I'm not a big fan of any ointments, lotions, potions that you can go and buy. And one of the things that I often hear people ask me about is, can I put fat on a burn? Absolutely no fats, no butter, no lard. All that's going to do is fry the area. All right, so please, please don't use that. Don't use any tapes or dressings over the burn either. And like I said, don't go removing any clothes that are stuck to it. Okay, insect bites and stings, probably quite appropriate for this time of year, isn't it? I've seen lots of wasps and bees around. So how are we going to treat it? Well, an insect bite, all we can really do is wash the affected area down with some soap and water. If it's swollen, I would go and get just something cold out of your freezer. Grab a pack of ice, some peas, some frozen peas, wrap it in a towel, and then place that cool compression on that sting. And what that would just do is reduce the inflammation around it and reduce the swelling. It's probably going to be itchy. Please, please try not to scratch it again, because all we're going to do is probably introduce infection as well, and that's going to prevent it healing. If it is itchy, I would probably recommend, if you can take it, having some Puriton, and that would just reduce the itchiness of that as well. With stings, bee stings and wasp stings, there's a real tendency for people to want to go pulling that sting out with a pair of tweezers. And what we know is tweezers are probably not the best things for pulling out stings, because quite often when you're pulling the sting out with a tweezer, we're only pulling the superficial part of it. The sting will break inside and that will still leave it, which can get infected. So what I want you to do, we've all got credit cards of some description, store card, debit, whatever you've got, guys, anything that kind of shape. And what I want you to do is go and have a look at the sting. And if you can, sometimes you can and sometimes you can't, you can kind of determine whether it's gone in at an angle or not. If it's gone in at an angle, we're going to use the further part to try and push it back up rather than pushing it the other way, which we've got then chance of pushing it in deeper. If there's no angle, don't worry, just go any way round it just to get it. And all you're going to do is, with the side of the credit card, just push that sting, prise it out with that credit card. All right, and then that will stop it from breaking inside the skin, under the skin. Okay. Bites, let's have a think about if it was a cat bite, an animal bite. Again, would be exactly the same. We're going to wash that affected area with some soap and water. If the skin is broken, again, guys, recommend that you do get medical treatment on it and you go to A&E just for some advice on that, as it might be worth a needle, or you might need some antibiotics in case there's an infection from that bite as well. Okay. Okay, so that pretty much sums me up. One last thing we'll just go through, contents of your first aid box. All right, so all I've done there is just put a little list together of what I think is quite useful for a first aid box. Now, what I would suggest, guys, is if you've got a first aid box at home and then also have a smaller one that you can just carry around you just for everyday use. What have we got in our first aid box? Plasters. Children love plasters, and potting a plaster on a child will stop them bleeding straight away. So they're really, really, really good to have. Triangular bandages, they're quite good as well. You can use them as slings. safety pins for the triangular bandage, large and medium dressings. Now I'm going to open this and just show you. So these dressings are brilliant for any wounds. So you can see they've got a nice soft centered bit in the middle, and then you've got the sticky bit around it. And you can get these in various shapes and sizes. And I'd really recommend that you have maybe 2 or 3 different, only one of each is enough, but maybe have 2 or 3, 4 different sizes in your first aid box. They come right from sort of a quarter of the size to much bigger pads as well. The other thing's nice about these is, remember how I said earlier about cotton wool's really rubbish? These are not like cotton wool, so they won't stick onto a wound. We're also going to have some sterile gloves. Really, really important if we're dealing with any blood or bodily fluids, that we go with sterile gloves. I put on their wipes, and they're just like antiseptic wipes. I think you can never go wrong with having a pack of antiseptic wipes on. I would say one thing though about antiseptic wipes is maybe steer clear of using them to clear wounds. Especially adults you might be able to get away with, but certainly not children. They are going to hit the roof because they're going to sting. And then it's just going to be harder to deal with it next time that they have a bleed. Okay. Micropore tape is always good just for sticking any dressings that maybe don't stick together. And then the non-woven swabs, this is what I was talking to you about, the non-woven swabs. Brilliant to have quite a wad of these in your first aid box. I would treat all my bleeds with these swabs, absolutely fantastic. And then we've got some paracetamol, always good to have in there, some ibuprofen. Ibuprofen is a great anti-inflammatory drug. So for any inflammation or swelling, again, back to your stings, ibuprofen works brilliantly. But again, there are some people that can't take ibuprofen, so please just make sure that it is safe for you to take it. And then the other one that I mentioned, actually I think I've spelt wrong on there, is Piriton. Okay. Alrighty, so I've just got a few questions that I thought you guys could have a look at and maybe answer with the person next to you, or we can call answers out. I don't mind how you want to do this bit. You tell me. Coms, what do you think the best way? Can I do it? Leave them a few minutes to have a look at the questions and then I can talk through them?
Yeah, I think so. If anybody does want to unmute and maybe have a go at answering any of those questions, maybe it'd be worth reading them out for those people who are maybe dialing in instead of viewing, so they may not be able to read it. Is that all right, Alison?
Yeah. Okay, so the first question, what is the acronym for treating a bleed? Okay.
Patricia Dunkley. SEEP.
SEEP, yeah. Well, was that Patricia?
Yeah.
Patricia, thank you. Okay. Head forwards or backwards to treat a nosebleed?
Forward.
Forward, yeah. And why forward? What's the importance of forward?
So that the blood doesn't go back down your throat and choke you or something.
Cause choking, yeah, it could potentially block an airway. Unlikely, but there's a risk. And also, it would just completely freak people out when they taste that blood. Not very nice. If there's an object in a wound, would you pull it out?
No.
No.
Leave it in there. So again, just to remind you, we're going to leave it in there, and then we're going to use that gauze to apply pressure around the sides of that object. And also it stabilises that object from preventing it from moving around. Excellent stuff. How about tweezers to remove a sting?
No.
I bet that's something new you've learnt today. That one often is a bit of a, wow, I didn't know that.
I would have gotten tweezer.
Yeah. It's the same with not just stings, I think tweezers, splinters. Again, the same thing with splinters. Try not to use the tweezers for it because the tweezers can break. Again, my card has come in so handy for removing splinters from my 5 nephews. It works, and they let me do it. They're all like under the age of 8, and they will let me do it because they know that this doesn't hurt. My mum used to get a little needle out, and she used to be pricking a needle or a safety pin under it to try and break the skin. None of that anymore. None of that anymore. Some of you are laughing, so I'm assuming the same thing probably happened to you as a child, or you've done it to other people. Okay. So when would you get medical assistance following a burn?
If it's larger than your hand.
Brilliant.
Or if it's black or blistered.
Excellent. Yeah, and that's either before you manage to cool it down or after you've cooled it down. And also if there's any clothes on. Okay. I've just answered that one, sorry. If clothes are stuck to a burn, would you remove them?
No.
No. How long could you cool a burn down for?
20 minutes.
Yeah,
20 minutes.
brilliant. Now, if that's, I'm just going to throw one other thing out there. If it's a child under the age of 1, only cool that burn down for 10 minutes because 20 minutes is too long for them in cool water. And then hypothermia, they can't control their body temperature like we can, and hypothermia can set in quite quickly. So 10 minutes only for a child under the age of 1. And can you burst blisters?
No.
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 Well, you can, but you mustn't.
That's what you said.
Let's see, but I didn't say it. Okay, how was that, guys? Have you got any questions?
You pointed out the harm. If there's a wound on the arm, to keep it high.
To keep it above.
Yeah. But
Yeah.
suppose the wound was on your leg.
Okay, does anyone want to answer that? What would you do if it's on the leg?
Put your leg over it.
Elevate your leg.
Elevate the leg.
Okay, so sometimes, guys, we just have to be a bit imaginative in fact.
Yes.
We know that by elevating that person's leg, it's going to slow that bleeding down. So
Yes.
what I would suggest is get them on the floor, get them laying down, and then you can put their leg on the sofa, put on a chair, on a few pillows, just so it's above their heart level.
Okay.
Okay.
Just want to make sure.
Okay.
Thank you.
Welcome.
There's been a question that's come in on the group chat, Alison, and it was from Shelley Ann, and she's asking, what should you do if a child loses a tooth, not a baby tooth, or if a piece broke off?
Great question.
Do you put it in milk?
If a piece, so baby teeth, like you say, it's no worry because they're going to get their bigger teeth come through. Once those bigger teeth come through, we want to hang on to them, right? We want to look after them. Teeth do come out with children. I've seen quite a few children being admitted to A&E when they've lost their teeth. Now, if it's just a bit of a fractured part, there's probably not a lot you can do with that, okay? If, however, it's the whole tooth, what I'm going to do is we're going to put it in some milk. Milk has got calcium in it, which apparently just keeps the nerves in the teeth going. So we're just going to place it in some milk and then take it up to your nearest dental hospital. All right, and it might be worth thinking about that, guys. Have you got a dental hospital anywhere, or a hospital that you can go to that will do dental 24 hours there? So just think about where you might be taking them, because it might not be your local. You might have to go slightly further out. If you've got no milk to put that tooth in, the other thing that would just encourage you
Cream.
just place it up in the gum of your own mouth, or of that casualty's mouth. If it's your children, you should place it up there. But if it's somebody else's, get them to put it up there. Tell them not to swallow it. And then again, just get them to the hospital. All right, and they can hopefully get it put back on.
Oh, wow.
What? So,
If I told this broken out, I'll put it back.
Hopefully.
right.
She just told you. I've
I
learned
thought you just
something.
threw it away.
No. Always put it in some milk.
I knew that.
Yeah. Well, you know.
There's another question that's coming on the group chat, which is what is the best management for a person with DVT when bleeding, which I'm assuming is deep vein thrombosis?
Yeah, so again, the management is going to be same. You want to stop the bleed. So it'd be exactly the same. And I don't know if you would know that they've got a DVT, so it's not going to make no difference to your management. Treat the bleed. And the main, again, the reason being is because if you don't treat that bleed, they're going to start to lose a lot of fluid. Fluid then potentially send somebody into shock and they could become unconscious, stop breathing. All right, so really important that we treat the bleed.
Okay, thank you for that. There's a bit more time, just in case anybody has any other questions that they want to ask. Is that Pamela Williams?
It's not a question. I've noticed you've got your baby assistant. Is it possible for you to give a short demonstration of a child's been choking? What procedures need to be carried out?
Yeah, I can do, absolutely. So this is an under one. So do you want, is that okay to do it on an under one?
Yeah, just...
Okay, fab. So I'll just go through firstly, I think it's really important that you know how to recognise it and the difference really between what is okay is what we class as gagging, which is a really good sign, and when it's not okay, i.e. when they're choking. And a lot of parents get that really confused and they think that sometimes when the babies are gagging, which is a good thing, they confuse it with choking. So we'll just clarify those first. So signs of choking, if something goes down the wrong way, i.e. into our airway pipe, we're built in with general, we'll just start coughing to try and clear that our airway. Same thing will apply to the babies, the under ones. They will cough and cough and cough to clear their airway. And what we want to hear, a good, strong, effective cough. And you can just hear there's a bit of oomph in that cough that's going to help expel that object. The other thing that this age often do is gag. And they can make some lovely, lovely gagging noises. And what you often see is that tongue's thrust out and you get the noises with it. Excuse them, but I'm going to demonstrate. That's a really good thing. That's a baby's safety mechanism to try and clear their airway. So at that point, we know that they've got something lodged, but they're dealing with it. And when I hear that good, strong, effective cough and that gagging with noises, all I'm going to do is I'm going to go over to the baby and I'm going to clear anything in front of them to prevent them reaching and putting it inside their mouth and making the situation worse. And I'm going to give them lots and lots of reassurance, get them to still cough, continue to cough, that gagging. Their face might be red as well, but I'm quite happy with that. And all I'm going to do is just observe them and give them lots of reassurance. If, however, that gagging becomes silent, or that cough changes and it becomes a lot weaker, and you'll just be able to tell from that cough that actually there's just not enough oomph in it for that child baby to clear their airway. If that colour red, which is okay, if that changes and that baby goes blue, they might go a little bit dusky on their face, or they might go a lovely shade of sort of purpley, light grey, maybe even navy around their lips and their face, or the baby goes floppy, I'm going to step in. Now, the way I'm going to help the baby is I want you to pick her up and I want you to sit down on a chair with her. I want you then to place the baby over your knee and support the head. And get the head in a downward position because gravity can help. Then we're going to find the baby's shoulder blades, and then we're going to come in the centre of the shoulder blades, and with the heel of your hand, we're going to give up to 5 sharp back blows. So we're going to just give 1 back blow, then just turn the baby over and check it hasn't surfaced to the mouth. If it hasn't, we're going to go for a 2nd back blow, check the mouth, 3rd, 4th, and a 5th. If the object's still not out, we're going to turn the baby over and again keeping them over your knee to support you and support the head. And then we're going to just come to where the nipples are and come in the centre of that chest, and we're going to do what we call 5 chest thrusts. So we're just going to push down quite harsh on their chest area. 1, check them out. 2, 3, 4, 5. If it's not out, we're going to go back for a 2nd round of 5 back blows. Alternated by second round to 5 chest thrusts. If after those 2 rounds you haven't cleared that baby's airway, it's really important that you either shout to somebody to go and call 999, or you stop trying to help the baby and you go and call 999. And then once that help was on its way, they will encourage you what to do next. All right. Now, just to say, with choking, what's happening with those back blows and those chest thrusts is it causing vibration in that baby's airway, and it's thought that that vibration is going to help dislodge the object that's stuck in their airway. And also, by giving the back blows and the thrust, we're forcing air up through their airway, which is hopefully going to expel the object as well. All
Great.
right. Now, I will say that choking, guys, is really quite common in babies, especially during that weaning stage. And I would recommend that any parents or grandparents who are looking after babies and children probably do attend the first aid course as well. All right, where they can maybe just practice that skill. Although it is very, very common, what we also know is that the back blows and the chest thrusts that I just demonstrated are very, very effective as well. All right, and the reason that we hear some deaths is because a lot of the time just parents don't really know how to handle choking, and they don't know what to do, and they just panic. All right, but that works brilliantly.
Excellent. Another question has come in, Alison. It was about the first aid kit, first aid box that you were discussing the contents of.
Sure.
How often do we need to review those contents?
Very good question. Review them. I think it's more about checking the expiry dates on them. All right, so I think it's just for you guys to be mindful of when the contents expire and when they need to be replaced. Okay, I think generally as the contents of first aid boxes hasn't really changed over the years. And you know, that list that I gave you, it's not set in stone. You can add to that, you can take things away. It's entirely what you're comfortable with, but as a bulk standard one, that's what I would suggest. But yeah, the only maintenance, guys, you really need to do it was just be mindful of the expiry dates on equipment.
Okay, great. I think Nicole's on the line.
Good evening. In the case of a baby, let's say from 1 year and below, how do you know, how hard do you do those taps on the back and the chest compression?
Yeah. It's difficult to answer that. How hard do you do it? I'm not giving the baby wind packs. All right. I am being quite forceful because I need to get that vibration and also need to get that air pushed up to try and clear her airway. All right. Now, if I can just reassure you guys, a couple of things with choking. I said to you, it's really important that when that baby's over your knee, we support the head, because we know that these back blows are quite harsh, which is why they're called blows and not pats. So they're called blows for a reason. And what can happen is when we give that blow, if I haven't supported that baby's head, it can fall forward and it can cause a shunting inside the brain. And what can happen is the brain will just shunt. It's a bit like whiplash. Under that pressure, the brain can shunt and hit the skull, and potentially that might cause a bit of brain damage, swelling inside the baby's head. But just by holding on to that head, we're eliminating that. Now, another reassuring thing just to say, guys, is a lot of people also worry about doing damage by giving these back blows, which is why they might not go particularly a big blow. But I just want to reassure you again that in the age of under 1, it's quite difficult to break any of their bones. All right, their bones are generally quite bendy up to the age of 1, for various reasons. So breaking bones in the under 1 is not very common. Okay.
There's a couple more questions that have just come in as well. They're coming thick and fast, which is really great. Oh, sorry, Nicole, did you want to come back on that?
No, I was just saying thank you.
Okay, no problem.
You're welcome.
The next question that's come in, it says, if a toddler inserts a small object up their nostril how should you remove it if they are unable to blow it out by putting pressure on
Yeah.
one?
Okay, so please don't take anything out. No tweezers going up there. You can just cause damage. It's really difficult to get children to sit still. The advice for anything in any orifice, so in the ears, or if it was stuck up their nose, I don't know what other places children can put things in, but please never take them out. Always leave them for the professionals to do.
Okay.
All right.
There's another question that's come in. I'll read it out. It says, what size, we're obviously a church organisation in Beulah Apostolic. What size box is appropriate for our local assemblies has been asked. And is the first aid box a legal requirement? And that's come from the Robinson family.
Oh, that's a very good question. Now, with regards to the size of the box, it's going to depend on probably the amount of people you've got on premises. What I would suggest is if you just pop along to the HSE website, they'll be able to better advise you on the size of your box and the contents of what you need. Okay. Is it a legal requirement? I'm going to put my hands up and say you've caught me out on that question, guys. I don't think it's a legal requirement, but you've probably got some sort of duty if you're having people on site to be able to sufficiently provide them with first aid, as in a first aid box. Does that make sense?
That makes sense. We'll try and get that, the HSE.
Yeah, and again, I would go on the HSE website because they'll be the better ones to advise you on that as well.
And just to confirm, HSE is what, Health and Safety Executive?
Yeah, yeah.
Good. So we'll hopefully put that up in the next few minutes on our chat. Another question that's coming in, they're coming in quick, fast and furious, we like it. Another question has come in from Eileen saying, would you consider it beneficial for buildings with a large gathering, maybe 100, 200, 300, to have a cardiac shock machine?
Absolutely. So cardiac shock machine, guys, is another name for a defibrillator. Absolutely. Defibrillators save lives, especially in the adult and the older population of children. Loads of general public are absolutely petrified about using defibrillators. They will talk to you. The advice to you guys is if ever you saw someone unconscious and not breathing, start your CPR and instruct somebody to go and get a defib. If we defib somebody within about 4 or 5 minutes of them going into cardiac arrest, we're improving their outcome by over 80%.
Okay,
the
excellent.
Statistics are huge.
Wow.
Yeah.
Yep, go ahead.
Does it need specialists? Sorry, I'm reading them off.
Good. We like it. This is good. Go ahead.
Do you need specialist training to use the defib? Absolutely not. It's always good to have some training around it just for your confidence. But in the meantime, guys, what I would suggest, go online, just Google how to use a defibrillator. And honestly, they are so easy. Let me tell you, we've done an experiment in work a little while ago. My colleague's daughter had to come in because they had a strike, or I think voting day or something. And she's 10 years old. She's never seen a defib before. And what my colleague done was she made her 10-year-old daughter in front of 25 student nurses demonstrate the defib. And all she said to her daughter was, I want you just to turn this machine on and follow the instructions. And the daughter got it, because they are that easy to use. You just switch it on and the defib tells you exactly what to do. And they are so safe. If they don't think that patient's in cardiac shock and it doesn't need shocking, it won't provide a shock. It would just tell you to continue giving CPR. If it assesses the heart rhythm of that patient and they need a shock, it's going to say to you, stop CPR, stand back, press green button to deliver shock. And then once the shock's done and it's safe for you to carry on, they will tell you to continue CPR. But they're very, very easy to use. And I think a lot of it is just about just people having the confidence to use it. You're never, ever going to get sued for using it, guys. Never. All right.
There's another question that's coming. This time I think someone's live, actually. BC is unmuted. BC, do you have a question? Nope, doesn't look like. there's another question there about who should administer first aid, a nurse or a first aider. Is there a difference, actually, in terms of...
No, so I think the big difference is nurses and other professionals are the ambulance, the police, the fire brigade. I think that covers them all, doesn't it? We're doctors, we're obliged to give first aid. Now, if I was to be seen walking down my street and I didn't administer first aid to somebody, and then somebody witnessed me walking past that scene, they could report me to my union or to my council, and we could lose our registrations over it. So we have to provide a duty of care. That's all professionals. First aiders, I'd like to think that they would provide a degree of care as well. But the public, if they're free and they're able to, they can also provide a degree of care. Nobody's going to get sued. We just don't have a suing culture in this country. No one's ever gone to the courts successfully and sued somebody because they've helped someone and they might have done it wrong or they didn't survive. This country doesn't work like that. We encourage people to go and help and do as best they can.
That's great. BC, do you still have your question? Last chance, BC. You've unmuted again. Okay, fine. No worries. BC, I think, is probably shy. I think we're out of questions, I believe. If there's any more last questions,